Dear colleagues, please welcome Professor and Pediatrician Rimantas Kėvalas.
So, good morning. Actually, I didn't find my photo in my childhood because I grew up in a very poor family. At that time, nobody had photo. And my first photo, maybe for someone it will be ridiculous, that was my wedding photo. So, good morning, ladies and gentlemen. It is both honor and privilege to welcome you to this gathering of the International Society for the Prevention of Child Abuse and Neglect. We come together not only as professionals, but as a global community united by a common commitment to protect children, to amplify their voices, and to ensure that every child has a chance to grow up safe, loved, and free from the violence. Khalil Gibran was a Lebanese-born poet, writer, and artist who lived in the United States. The Prophet is Gibran's most famous work, actually that is a true masterpiece. So, and a woman who held a baby against her bosom said, "Speak to us of children." And he said, "Your children are not your children. They are the sons and daughters of life's longing for itself. They come through you, but not from you. And though they are with you yet, they belong not to you. You may give them your love, but not your thoughts, for they have their own thoughts. You may house their bodies, but not their souls, for their souls dwell in the house of tomorrow, which you cannot visit, not even in your dreams. You may strive to be like them, but seek not to make them like you, for life goes not backward, not there is with yesterday." Child abuse has a profound and lasting impact on children's lives. It doesn't only harm their physical or mental health, but also disrupt their social and emotional development. These children are the creatures of behavioral problems, aggression, depression, and even suicide. Moreover, the effect of often extend beyond the individuals, contributing to intergenerational cycles of violence and instability. Infant abuse may cause severe physical injuries and irreversible neurological damage. Understanding these consequences remind us why early recognition and interventional act. One of the most difficult aspects of child abuse is that children rarely disclose their experiences. Often, they do not even realize that what is happening to them is wrong. Instead, they may feel guilty, ashamed, intimidated, or afraid that nobody will believe them. This silence makes our responsibility as professionals and as society even greater. International Society for the Prevention of Child Abuse and Neglect is an international organization founded in 1977 by pediatrician Henry Kemper of the United States. In 1962, he published an article, "The Battered Child Syndrome." This article marked a milestone in medical literature by presenting the first formal description of physical abuse in children. It established child abuse as a clinical condition and caused physician responsibility to recognize signs of trauma and highlighted the ethical duty to take prevention action. Today, the impact of this work is clear. Physicians are legally required to report suspected abuse, and the recognition of child abuse is now a standard part of medical practice. Number of prevention and support programs have been created worldwide. Dr. Kemper's publication is considered a true turning point a milestone that fundamentally changed the course of child protection. In 1972, pediatric radiologist John Coffey described a distinct pattern of brain injuries seen on CT scan, including hematomas of the brain lesion or retinal hemorrhages, without any external head trauma, signs of external head trauma. He concluded that the injuries were caused by a violently shaking the child. This work laid the foundation for that we now recognize as shaking baby syndrome. This slide shows how rapidly in the United States developed a comprehensive child protection system once the issue of child abuse was recognized. Following the publication of a groundbreaking article in JAMA in 1962, mandatory reporting laws were introduced across all 50 states within a decade. Key legislation such as the Child Abuse Prevention and Treatment Act in 1974, and later the Victims of Child Abuse Act and the Adoption and Safe Family Act, creating a strong institutional framework. This case was in 1992, but I still remember very, very well. The infant was just 3 months old, admitted to our pediatric intensive care unit due to loss of consciousness, seizures, and respiratory failure. The CT scan showed an acute subdural hematoma and cerebral edema, injuries that didn't match the parents' explanation. And the explanation was very, very ridiculous, that the baby just slipped out from the hands. After neurosurgery and intensive care, the child was discharged, and 2 months later he returned with the same injuries, and despite all our efforts, passed away within hours. The autopsy confirmed a pattern of brain injury inconsistent with accidental trauma. I reported this case to the police, but the investigation was discontinued because they trusted the parents' story. In 1993, during my first clinical training abroad at Karolinska Hospital in Stockholm, Sweden, I heard about shaking baby syndrome for the very first time. It was described as a form of physical abuse diagnosed by the presence of subdural and retinal hemorrhages in infant. This experience was eye-opening and marked the beginning of my deeper commitment to recognizing and preventing abusive head trauma. After my first encounter with cases of suspected abuse, we decided to conduct a retrospective study of children under 3 years of age admitted to the pediatric clinic in Kauno Medical University Hospital. Our goal was to understand the causes and clinical presentation of trauma in our own institution. At that time, we didn't have national database on child injuries due to violence in Lithuania, so this study became an important first step toward building local evidence and better child protection. As we investigated these cases in greater details, we discovered additional injuries, such as fractures, rib lesions, and lung contusions that hadn't been suspected at first. This was the turning point when we decided to introduce full skeletal surveys and comprehensive imaging whenever abuse was suspected, making the beginning of a systematic approach to diagnosing non-accidental trauma in our clinic. So international data showed that incidence of shaking baby syndrome is estimated approximately from 15 to 30 cases for 100,000 infants. At that time, the national birth rate in Lithuania was about 30-35 1,000 children annually, which is much more bigger than we have now. So shaken baby syndrome theoretically could be about 6-11 cases per year in all Lithuania. In our PhD registry, we documented 34 cases of shaken baby syndrome between 1994 and 2002, which is average 4.25 cases per year. And between 2006 and 2009, this number increased to 51 cases, or nearly 13 per year. It's important to note that these numbers reflect data only from our clinic. At that time, and now we have another big hospital in Vilnius University Hospital and 3 regional hospitals with the pediatric intensive care unit. So this slide illustrates how the reality was faced in Lithuania during the early years. Pediatricians often worked in complete isolation, without psychologists, social workers, or a support team. Reporting of suspected abuse wasn't mandatory, and when cases were reported, police response was frequently very slow. Shaken baby syndrome was often misdiagnosed or completely missed. There was no structural collaboration with police or forensic expert, which left physicians feeling powerless and alone with the responsibility for these children. This was an emotionally very difficult period for many doctors, and they faced children's suffering with limited tools and support to intervene effectively. Learning from international experience was a turning point for us. We saw the results from the Netherlands when e-learning significantly improved emergency staff's ability to recognize child abuse. Inspired by this model, we mobilized our own internal resources to employ social workers, even before there was no dedicated funding for this. Most important, we design and implement our own training program for medical staff, involving a truly multidisciplinary team: pediatrician, traumatologist, psychologist, emergency physicians, and social workers. This collaboration approach became the foundation for more systematic and consistent response to suspected child abuse in our hospital. Later, national guidelines were developed in Lithuania, covering all forms of violence against children: psychological, physical, sexual abuse, and neglect. These guidelines describe how to identify and assess suspected cases, outline diagnostic and legal steps, and provide practical tools such as reporting forms, contact lists, and institutional pathway. Their introduction marked a major step forward, ensuring that all professionals across the country follow the same standard and that every child has a clear path to protection and support. This timeline illustrates how child protection has evolved in Lithuania over nearly 3 decades. From the ratification of the United Nations Convention on the Rights of the Children in 1995, to the establishment of the Ombudsperson for Children, the expansion of welfare service, and the 2017 ban of all forms of violence, and the creation of the National Child Rights Protection Service. One of the biggest challenges we face is the lack of social workers in the hospital. Because their work is not reimbursed by the National Health Insurance Fund, hospitals are not incentivized to employ them. This leads to stories of specialists forcing a few available social workers to cover many departments and focus only on quick crisis-oriented solutions instead of long-term support. Another problem is bureaucratism. Paperwork consumes a lot of time and limited time for direct engagement with children and families. And perhaps the most painful reality, for today we still don't have 24 hours child abuse response team, especially for children who have experienced sexual abuse. However, this remains one of our key goals to ensure that in the near future every child will have access to immediate, comprehensive protection and care whenever it needed. This slide shows how few social workers we have in Lithuanian hospitals compared to leading international institutions. For every 100 pediatric beds, that our number are dramatically lower, sometimes 10 to 20 times lower than in top centers like in Children's Hospital of Philadelphia. This is not just a statistic. It means that many children and families go without the psychological, emotional, and social support they desperately need during hospitalization. To compensate, we sometimes reallocate nursing positions to higher social workers, but this is far from a sustainable solution. Munchausen syndrome by proxy is a rare but a very, very serious form of abuse. It occurs when a caregiver deliberately causes, exaggerate, or fabricate illness symptoms in a child. These children often undergo repeated hospital visits, unnecessary tests or procedures, and may suffer physical harm or even death. Munchausen syndrome by proxy remains one of the most challenging conditions to diagnose. What makes this diagnosis particularly complex is not only the deceptive nature of the caregiver's behavior, but also systematic barriers. In Lithuania, current regulation prohibits the installation of hidden cameras in hospital wards. This means that direct observation of caregivers' behavior, often the key of confirming the diagnosis, is limited to what staff can witness in person. Lithuania has come a long way. We have built systems, created guidelines, and taken important steps to protect our children. But this work is never truly finished. Each case of harmed child reminds us that we must stay alert, compassionate, and united. Concluding, let us remember that every child is more than a patient, more than a case, more than statistics. Every child is our future, a promise of what our society can become. Protecting them from the violence is not only a medical or legal duty, but our moral responsibility. When we give children safety, care, and dignity, we invest in a better, kinder, and healthier world for all of us. And finally, I would like to quote the words of Dr. Rimantas Kėvalas to the bishop from Albert Camus' novel The Plague. It is completely incomprehensible why a child should suffer. And in fact, there is nothing more important on earth than the suffering of child and the horror that this suffering brings with it, and the motive for the suffering that must be found. Until my dying days, I will refuse to love a system in which children suffer. Thank you very much.